Hello friends, as we told on the last video that we will be telling you regarding the neurogenic claudication and its management. Today we will be teaching you how neurogenic claudication it is treated and what will be the physiotherapy management for the neurogenic claudication. As you already came to know, neurogenic claudication, it is a condition where there is a canal stenosis, and that just because of the canal stenosis the pain it used to radiate from lumbar spine on the both the sides, and that's the main feature of neurogenic claudication, where the pain is to radiate bilaterally. And what type of symptoms patient used to have? Patient used to have, they used to have a severe muscle spasm. That means they used to walk and they used to having a severe pain over their thigh and mainly the hamstring and the calf muscles, and they cannot walk properly. So that's what we learned from the last video, and today we will learn how to treat. That means what will be the evidence-based physiotherapy management for this particular condition. So be with our video so that you will learn how to treat the neurogenic claudication as a evidence-based management in the field of physiotherapy. Now let's see how evidence-based physiotherapy management for the neurogenic claudication is done. So the whole rehab of physiotherapy protocols is divided into two main important parts. One is the electrotherapy point of view, and one is the exercise and an advanced level of physiotherapy point of view. So first I will teach you what will be the electrotherapy point of view, and which has the evidence that it is helpful in case of neurogenic claudication, that is a burst tense. Now you need to remember only the burst mode of tense which is useful in case of neurogenic claudication, because it works on the extra segmental inhibition of the pain pathway. So now I will teach you how you will keep the electrodes the time you will be treating in case of neurogenic claudication and in case of spasm, which is mainly seen in the hamstring and the calf. But it will be different from the conventional tense electrode placement, where you would have kept the electrodes over the nerve roots. But for neurogenic claudication, as most of the patients they used to complain, they are having pain over the hamstring and they are having pain over the calf muscle, and that's the thing you need to do. You need to keep the electrodes, over the muscle only, Now how we will keep? See how I am keeping. I am keeping one channel, both cathode and anode, over the hamstring, and the another channel I will be keeping over the calf. So I am not keeping any of the channel over the lumbar region or the sciatic nerve root, because I am not inhibiting the pain via the segmental inhibition of pain pathway. I am inhibiting the pain via the extra segmental inhibition of the pain pathway, and the minimum or to maximum duration of this particular treatment it's supposed to be 15 minutes of duration, where we can see the muscle contraction. So that's the electrotherapy point of view, where burst tense it is effective in case of pain and fatigue over the hamstring and the calf muscle for the neurogenic claudication. Now we will see the exercise therapy point of view and manual therapy point of view, how to treat this condition. Now coming to the exercise therapy or advanced manual therapy point of view, the evidence what is proved, that's the neural mobilization or the sciatic nerve gliding or sliding exercises. It's beneficial, mainly we used to do the sliding exercises for the sciatic nerve, which improves the nerve conduction velocity, and that ultimate improves the muscle pain and the fatigue level. So sciatic nerve neural mobilization as a sliding maneuver we used to use in case of as a manual therapy, which is given by the Butler point of view. Now how to do this? Consider the patient is in a supine position, and what you will do, let the limb to get elevated till 45 to 50 degree to maximum of 60 degree. In this 50 to 60 degrees of hip flexion, you will just adduct the limb of 10 degrees, and slowly you will do the dorsiflexion with the great toe extension, and at the same time you can ask the patient to go for a lateral flexion of the neck also. And in this particular position I will hold the limb for 30 seconds and I will repeat it for the 7 times. So that's the dosimetry. You need to understand that the time you will do the Butler neural mobilization, the minimum duration of hold supposed to be 30 seconds, and you need to repeat that particular treatment protocols for 7 times. So that is Butler neural mobilization, which has the evidence that it is effective in case of pain which is just because of neurogenic claudication. The second school of thought which showed its effectiveness, that is the Mackenzie's flexion principle. What? That's the Mackenzie's flexion principle. You need to remember the Mackenzie's extension principle you are supposed not to do. The reason, because you know in neurogenic claudication, whenever the patient will adopt a flexion posture, the pain is to reduce, but the patient, if you adopt the extension posture, the pain is to get increased. So any exercises which will be recommended for a patient with neurogenic claudication, that's supposed to be Mackenzie's flexion principle exercise. So whatever the lumbar exercises we will be doing for any of the patients, that's supposed to be according to the Mackenzie's flexion principle exercise. This principle which is having its effectiveness, that's the TheraBand strengthening exercises, and it's very much beneficial the time we will be strengthening the hamstring and the calf, because this muscle is to get fatigued, but not in the initial stage. Once you will be achieving the pain level, the time the pain level it will decrease, that's the time you will start doing the TheraBand exercise for the hamstring and calf. We'll just show you how to do the TheraBand exercises for the hamstring muscle. Just this depends upon the resistance. Slowly you will start with the lower resistance of TheraBand and it will slowly increase with the higher resistance of the TheraBand. And we will ask the patient to flex the knee. So like this we will repeat it for the 10 times. The time we will do the exercise for the TheraBand, 10 times we will repeat for hamstring and again for the calf, and that's the same times 3 times as a set you need to do. So that is what is the TheraBand exercises. So as a whole, this whole exercise principle or the whole physiotherapy principle, it depends on the two parts. One is the electrotherapy point of view and the second one is the manual therapy point of view. If we go with the electrotherapy point of view, it is the burst type of tense which is effective in this condition, and if you go with the manual therapy and exercise point of view, it is the Mackenzie's flexion principle number 1, Butler neural mobilization as a sliding phenomena as a number 2, and TheraBand exercises as a strengthening phenomena of the particular hamstring and the calf, there's a 3. And you can also slowly start with the gait training. You can start with the endurance training of that particular muscle and the eccentric training too of the particular muscle to give the strength. So that is how the physiotherapy management for the neurogenic claudication it is indicated. So thanks for seeing this video, and we expect you people to subscribe this channel, to like this video, so that we can make different type of healthcare updates. We'll come with different type of healthcare videos to you people, so that it will be easy for you people to learn, to treat and different type of conditions. Thanks.